Most pain doesn't come from injury. It comes from trigger points in muscles. But you have to understand which muscles are worth treating and which ones aren't. For example, I'm sure you know somebody with sciatic and IT band pain. Your clients, your family, maybe even you. Most people treat sciatica in the leg by rubbing it where it hurts and rolling their IT band. But that's actually just treating the symptom and not the cause, and it doesn't really work. More about that in a second. My name is Chuck Duff, inventor of Coaching the Body method. I had serious sciatic pain when I was younger, and nobody knew how to help me. I had to figure it out for myself, and now I've taught it to thousands of students at my school over the last 15 years. So I'm going to show you some of this work in a moment, but if you want a more in-depth training, please register for my free 90-minute web class, and you'll see links in the video. Look forward to seeing you there. Just because your quads are tender, and you find tenderness when you foam roll, doesn't mean you're doing anything productive. What's probably happening is your TFL and your anterior gluteal fibers are sending pain into your quads, and that's getting your quads in trouble. And you can foam roll that every single day, and it never really changes. It always comes back. So if that's what's happening, you're going to want to focus more on these gluteal fibers and on the QL. So this is, anatomically, this is adduction. Now people think they call this stretching their IT band. It is not stretching the IT band. You cannot stretch the IT band any more than you can or would want to stretch a ligament. If you stretch a ligament in your ankle or your knee, that's a problem. That's called an injury. That's something then that will make your joint unstable. So what we're actually stretching are these fibers, the TFL fibers, anterior gluteal fibers, posterior gluteal fibers. One of the things that I want to make you aware of, I do trigger point therapy. That's something that some people know a little bit about, but generally it's kind of a lost art. And we talk about pain referral. So pain referral means that you have a problem in a muscle, let's say in your hip, but where you feel the pain is running down your leg. So one of your gluteal muscles, glute minimus, actually can send pain down the leg, can create symptoms that definitely would be felt in the same areas as so-called IT band pain. As I come across, you tell me what you're feeling.
I can feel it already.
And where do you feel it?
Part of the leg, even lateral, about only a few inches above the knee, it stops.
Okay, so Will is already feeling pain down the lateral leg. Now, that's not because of his IT band, that's probably because of his TFL and his glute minimus. So this just tells you right away. Now, I'm not just going to keep stretching that. It wouldn't be productive. So what we always want to do is we want to put some compression and vibration on those muscles. So very easy. And then I'm just going to let that leg come through. What are you feeling now?
Nothing.
So at this point, actually more like here, when we started, he was feeling lateral leg pain, IT band pain. IT band pain is now gone. So that's what I mean. This stuff works really quickly, and he's got a whole lot more adduction.
Still don't even.
Still good?
No tension at all. No.
Wow, look at that. That's crazy. Follow the link below to register for my free webinar, How to Fix Your Client's Pain by Understanding Where It Really Comes From. You're going to learn an approach we call Trigger Point Therapy 2.0, which we use to consistently eliminate pain for good. I'll show you how to discover where pain originates, and it's hardly ever from an injury. You're going to start to understand why rubbing where it hurts never works. You're going to see our proprietary trigger point tool, the muscle liberator in action, and how you can use it to soften taut fibers in seconds if you know the right place to work. And to thank you for registering today, I'm going to send you a free copy of my Coaching the Body Out of Severe Shoulder Pain course, which is normally $39. Thanks for watching, and I look forward to seeing you in the webinar.